For our next chapter, we want to talk about disturbances in gas exchange. This is very important in evaluating sick patients. And they will ask a couple of questions on the boards when they talk about pulmonary patients concerning this issue. So there's two formulas that we need to know a little bit about. Not 100%, but we need to know a little bit about. The first formula is the formula that tells us about oxygen delivery. Oxygen delivery, what I mean by oxygen delivery is oxygen delivery to the vital organs. What are the parameters that go into oxygen delivery at the vital organs? That's what I'm really asking here. And if you look at this formula here, right here, the first one about oxygen delivery, you'll see you don't have to memorize this. You need to know the concepts though, because I'm going to give you the question that they've asked on the boards. Here it is. Oxygen delivery equals cardiac output, this is CO, cardiac output, times hemoglobin, times this coefficient for hemoglobin, times the hemoglobin saturation, and then you add on to that the partial pressure of oxygen. This is the diluted oxygen in the blood. This is the one that we get in the ABG when we check it. And this is multiplied by this coefficient, 0.0031. Now, we don't have to know this whole formula, but what do you get out of this formula? That, yes, when a patient comes in and is dyspneic and hypoxemic and so forth, the first thing we do is we slap on some oxygen on the patient and we make his PaO2 go up. It goes up from 50%, right, from 50 millimeters to, 100 millimeters. Okay, that's fine. But look at this. This part here plays a very small role in the total delivery of oxygen to the vital organs. It's a part, but it's a small part right here. So it's not, it's not totally negligent because, you give the patient oxygen really quickly and correct that, but it's not the first thing that really is going to matter in this patient. But two other things matter, and that's what they test. One is the cardiac output, right? You have to be able to maintain stable cardiac output to maintain the oxygen to the vital organs. So they tell you, what is the one most important things in patients presenting with dyspnea and stuff like that? Well, they have to have normal blood pressure. They have to have normal fluids. They have to have normal perfusion of organs. Anybody who's hypotensive, no matter how much their oxygen is, they can't perfuse the vital organs unless their cardiac output, right, and their blood pressure is stable. The second thing, and it's probably the most important thing in terms of the boards, is this thing about hemoglobin right here, where we need enough hemoglobin in our body to be able to bind to oxygen and then deliver it to the vital organs. So it's not dilute oxygen in the blood that gets delivered much to the vital organs, but it's the hemoglobin that grabs onto oxygen and is able to deliver it to the vital organs. So they ask you, what is the most important thing in a patient who is hypoxemic, who has a lot of medical conditions and is intubated and stuff like that? What is the most important thing that we maintain? The most important thing in this patient is to maintain the hemoglobin level above 10. Hemoglobin level above 10, hematocrit level above 30. So when we round in the intensive care unit patients and we present patients that are really sick and have multiple medical conditions, that they're hypoxemic and all that stuff, and they're on ventilators, and the attending asks, well, what's the ABG? Well, he knows that you're going to be able to, take care of that with the ventilator, but then he says, what is the hemoglobin and hematocrit? And he or she is getting at this thing right here, that you have to have a normal hemoglobin and hematocrit to be able to deliver oxygen to the vital organs. That's very, very important. So if they present to you a patient who's hypotensive, who's hypoxemic and all that stuff, and their hemoglobin is less than 10, you have to transfuse that patient, the hemoglobin above 10, in order to be able to deliver oxygen to the tissues. If you don't, you could give them all the oxygen you want from the ventilator, you're not going to be able to get it to the vital organs. So this is the premise And the theory behind this